Welcome to Horton Implants Oral Bites with your hosts, Kate Bootman, Will Murphy, and Carl Horton.
Spain were winning 1-0 when I checked last.
Still, I think.
Well, good evening, everybody. Welcome back on this rather balmy, warm Friday evening. Hope you're all well. You will see that I am joined by the lovely Will Murphy, the lovely Carl Horton, and this evening, for one night only, we are also joined by Rob Teague from Restore Surgical Limited. Hi, boys.
Hello. Hello.
Yeah.
England.
Very good. Very good. Yeah.
Don't get me started. Don't get me started. It's all so
Would I be
exciting.
rude in saying boing, boing, it should be baggies, baggies? Or have we got, mostly Villa and Blues people here?
Tottenham.
Good heavens. Yeah, I'm a blues person, but don't worry, mate. It's fine.
Yeah, we don't mind the Blues, actually,
Yeah.
I think. But Albion and Blues seem to get on all right, don't they?
Yeah, they do.
Cardiff City, I'm afraid.
Okay,
so
I thought
let's
it was
just-
okay. Yeah, similar story.
Never mind.
Yeah.
Right,
Crack on.
Mr. Murphy,
Hello.
indulge us. Tell us what your week has been like.
Do you know what? I am still buzzing from the weekend because I was very kindly given a hospitality package to Edinburgh to watch the Lions game.
Wow.
So this was also the first time I've been on a plane in probably 2 years, something like that,
Yeah,
which all felt a bit weird. So
I bet.
I was taking pictures in the airport because it was like a ghost town. And then as soon as you get on the flight, it's like nothing's ever happened. People shoving their bags up, pushing in
Brilliant.
next to you, except they've all got masks kind of somewhere around their chin. So it was like the good old days. It was war was over. So, but anyway, I arrived in Edinburgh, which was lovely. Had a little walk around, and then went to the game. And then we were like hobnobbing with some legends of the rugby world, former
Yay!
British and Irish Lions, including Sir Gareth Edwards and Martin Johnson. And
Oh wow.
Any Mike Teagues?
no Mike Teagues, unfortunately. No Gloucester legends.
Yes.
So. And bizarrely, H from Line of Duty. I don't know if anybody watched Line of Duty.
I thought you were going to say H from Steps.
No, that would have been amazing.
Yeah.
I would have been
5, 6, 7, 8.
tragedying with the best of them. Should I do that again?
Yeah.
So yeah, there you go. That was like, that kept me busy, and I sort of limped home on a flight on Sunday.
Was it the Flybe turboprop service?
No, it was full beans, easy jet.
Oh, okay.
Yeah, everybody crammed in, no distancing between seats or anything like that. Everybody, coughing and spluttering over each
Well,
other.
that's what I was going to say. When I used to go to Edinburgh for a previous company I consulted for, it was always those tiny little turboprops, and you couldn't distance in there.
Yeah, no. I've done the Flybe, the turbos up to Edinburgh, but no, this was the luxury of a jet. So yeah, that was very nice. So yeah, I've just had to sort of get through the week's work. Then Monday night was my eldest 25th birthday. Went out for a nice bit of grub. Tattoo restaurant in town. Recommend that for anybody. Very nice.
One of the nurses is going there this weekend that we've been working today.
Awesome. Really, really good. And it's my youngest's 19th birthday. So there was a sort of worrying collection of 19 to 20-something-year-olds sitting in my garden with crates of beer, having far too good a time. But now they've just mysteriously disappeared. So,
Carl, do you remember probably this time last year when it was Will's son's birthday? We lost Will for a bit, and he reappeared in a broom cupboard.
I remember it well.
That was just a horrific experience. I was hoping it was going to be repeated. Because he crashed a bird about 10:30.
Not Boris Becker's broom cupboard though.
No, none of that nonsense. No, and then he decided to make a mess of his bedroom, which I had to clear up the next day. So so far, compared with that, it's all gone swimmingly.
Excellent.
And work-wise, you still busy?
Yeah, very busy. One of those moments where I didn't have something I needed. And there was a bit of a panic stations. Fortunately, a good friend of ours who also does implants in and around Brindley Place. Quick phone call to him, and actually, I'll tell you what was good. I stepped outside of the surgery. I was going to run over, but one of those nice Voy scooters was outside, so you couldn't ride this. So I jumped on a scooter, scooted over to his surgery, got the bits and pieces that I needed, and then scooted back again.
Absolutely brilliant.
All done and dusted. Only running 20 minutes behind.
Did you take any pedestrians with you, i.e. bounced off them?
No. As soon as you get round the library, there's an automatic speed control, which drops you down to pretty much walking pace, which is a bit annoying. But then as soon as I got onto Gas Street, it was back to
the gas,
full beans.
Brilliant.
I
would have loved to have seen that. I'd have loved to have seen it.
I wish there could have been a camera following me.
We could have put music to that, Will.
It was all a bit Benny Hill for sure. So there you go. That was my week.
Well, you sound like you've had a wonderful week.
I've quite enjoyed it, actually. Yeah.
I can tell you have. And what about you, Mr. Horton?
Yeah.
I knew you were going to do this.
Fixed a few teeth.
Yeah. After last week, it's probably best that I say very little.
No, you can tell us about your gardening again.
Cadaver Day, which is always good fun on Saturday. When Will's, ligaring himself up or whatever he's drinking, I was indoors, no phone signal, which is always a bonus, to be fair. But we had the Cadaver Day. You had one very humble student who, because they it's where they get the chance to place an implant for the first time, possibly, and raise a flap and do the suturing. And we had one very humble student that I said, has anybody placed implants? And he kind of went, yeah. And he disappeared off, and he was doing all these fantastic block grafts and sinus lifting and repositioning the nerve and all this. And how many implants have you placed? Oh, a few thousand. So for him, it was just a walk in the park.
Are you like, why are you on this course?
Yeah. I think
I got a claim to fame there. I was the first to do a cadaver dissection course in the UK. First to ever organise one. And the first to take anybody overseas to do them. Yeah. We used to first thing, because you'd have had US cadavers maybe.
Yep.
Yeah,
that's right.
Yeah, which is we brought those in with the anatomist down at Royal College of Surgeons.
Vichy.
That's it. Well done. Yeah,
he's a legend.
Yeah. That'd be about 18 years ago, something like that. And around the same time, we took first group over to university in Austria, Graz, and they used to do pickled herrings, we called them, but they were sadly pickled cadavers. But if you didn't like the one, there was always another one down below, so that it was a strange environment.
I think if you're not used to it as well, it can be a little bit, some of the reps that come in, they've never seen anything like that. They kind of, they get they get weirded out by it. It's probably the best way to put it.
Yeah, it's fascinating. But because Austria and Graz is quite associated with this other guy that did the modelling years ago. He had a world tour, didn't he? Gunther Hagens or something like that. And he'd got this plasticization technique, hadn't he?
That's right.
Preserving, and they'd used something similar to that in the university, so they did weep a little bit, but obviously they were a bit shrinkled and pickled. But in Austria, or certainly in that region of Austria, if you don't want a funeral, you can donate yourself, and they'll cover some funeral costs for you. So there's quite a high input of cadavers for them to use. Interesting. And then from that, we found out that you could bring them in from the US, and did the first one, and that was with Vichy, and then with Shamal Usa and Corey Firan.
Very good.
They're a good group you had, though, Carl. I mean, they're keen at things like that. I mean, they make the most of it.
Fantastic. Yeah. It's a full-on. It's a great experience for them, and it's a great day. And then one after that, full arch case, another immediate full arch case. They're coming in thick and fast all the time at the moment. And then today, the lovely Malvern, and I think Hereford might have been interspersed in this at some point. I'm looking at Kate. and Malvern today, which is always a fantastic experience. Always Ben, who's been on here, who is a very different character in personally. You have to censor him.
Yes.
You do have to censor him. And
I've met him. He's quite solid with his sense of humour, isn't he?
Yeah,
he's fabulous. Fabulous. I need to lie down in a dark room after spending half an hour of my lunchtime with him.
You've got the bleep button, haven't you? You just like
Yes.
Yeah. And then running basically, and that's it. And that's been my week.
Oh, good boy, Carl.
Got the tape ready.
Well, thank you very much, boys. Well, Rob, thank you so much for joining us this evening. I mean, obviously, we know little bits about you, but we would love it if you could share
this bit.
If you could share and tell us all about Restore Surgical Limited. So, what's it about, and what does it do?
Yeah. Well, we're trying to do something different, and I think when you're coming into this, as I did, starting my own company from a consultancy, you're in an unusual place in the beginning. So, but I'll take you and the guys back a couple of steps, because I'm a West Midlands pharmacy trainee years and years ago, and I got into this in a strange way. But the way I got into this actually underpins what I'm trying to do now with Restore, because I came in through sterile production, and as a regional pharmacy trainee, we used to produce pretty much every pharmaceutical form that's available. So I used to say, any orifice and any surface, we've made something that, gets the drug through there at some time or other. I even made toothpaste, believe it or not, but it wasn't widely used, shall we say. But sterile fluids and injections and creams, pastes, drops, tablets, douches, everything else was still produced in the early 80s in the West Midlands. Nothing was bought in. Most of the hospitals consumed stuff that was made in the sterile production centre, and I was one of the guys that used to do that. And then I concentrated on ophthalmology with the eye hospital and with the service at Dudley and Sandwell, and this would be middle 80s. And from there, strangely, I got offered a job to work in the industry, and I joined as a rep for an ophthalmic company. And through that, my interest went more towards surgery, and I found myself getting promoted. Went on a training course to become sort of product manager and marketing, and went into product development. And that's really the first key step for me that has sort of allowed me to use my pharmacy background and then apply that to bigger companies and for commercial reasons rather than just hospital. But I got really bored with the NHS, like most of us, I suppose, and fell out of love with it. I wanted to get into sort of elective private surgery where, just like this, I could use my marketing opportunities to engage the purchaser rather than having to go through layer upon layer upon layer of bureaucracy. And it's a really odd thing, but I found myself going into maxillofacial, which wasn't too big a step from surgery. So in the sort of mid-90s, I went into the maxillofacial field and had a very interesting career there. And then around 1998, which is really quite crucial, the medical device directive came up, and a lot of products that would have been made available that would have been drugs could then be made available as medical devices, and that opened up a massive opportunity for development. And I got really quite involved, went into orthopedics and helped develop a range of products for bone and tissue regeneration for cartilage. And from there, strangely, I got offered a job with a company called Geisslich, which of course you'll all know. But at that time, Geisslich was a pharma company. We're talking now in the late 90s, around 2000. And I won't embarrass anybody to ask what they were doing in 2000 in relation to implant dentistry, but not many people were doing not very much in the UK. It's always been a small market, and at that time it was maybe 20,000 implants, so really quite small. And the regenerative market was equally as small, and autogenous bone was still the king. So I was given the task of launching the biomaterials division for Geisslich, and that was my first job, really focusing in on implantology and primarily into regenerative technologies. And I suppose I learnt too much, or I perhaps had too much exposure with a one-dimensional company and fell out of bed really with some of the things that we were doing. I'm proud of many of the tasks that we achieved with Guy Slick, the training and everything else. But I just felt there was, having come from the orthopedic and having some knowledge of what they were doing with bone regeneration in orthopedics, I just felt that if you really wanted to be a major player, you had to be involved in more protocols and more ways of doing something. You know, that we'll all agree there is never one way to skin a cat, as the phrase goes. There's always multiple ways. And I couldn't get that across, even though I was in a senior capacity at Guy Slick. I couldn't really get it across, so I left. And I was invited to go back to an orthopedic firm, and some of you guys might actually know. I think, Will, you were a Fortos Vital user, if I remember. We spoke about it, and I helped develop Fortos Vital, which was probably a major thing in my career when I think it back, because here was the first time that a UK company was producing an orthopedic synthetic product, and they invited us to take it into dentistry. But funnily enough, and we can perhaps talk about this, dentistry wasn't ready for it. And we ran into a brick wall. And it's funny how, you know, you think, oh, bone's bone, but, you know, if you've got a product you supply to orthopedics, you market it or promote it in the same way as a product you supply to dentistry, and quite clearly you don't.
What year was this? When was this?
So that would be, I was about 2009,
yeah,
2008.
Yeah.
So you had Swallow Dental were the distributors in the UK. They'd started selling it. At the time, it was Fortos Perma, Fortos Resorb, and Fortos Sema. So there were 3 calcium products that the Biocomposites, the manufacturer, produced. And the history was fascinating because they're based in Stoke-on-Trent, and I don't work or have any association with them. But today it's just quite interesting because we don't think about it. Stoke-on-Trent, clearly the potteries, and fine bone china, obviously produced in the potteries. And the glaze that you use on the side of a ceramic pot to make it really hard and shiny used to have bone in it, and melted bone went really hard. And it made that glaze on they called it slip, didn't they? I think, made that glaze on the surface of the mugs. And that's the background. In fact, a lot of the old potteries firms would buy in animal bones, cook them up, and that's how they created their hard surface. And strangely, Guy Slick went that same way, ironically, in Switzerland, but they were producing glue, believe it or not, for as an industry for 100 years, and found that a byproduct of the processing of the animal tissue was a biomaterial. And strangely, in the UK, a byproduct of the ceramic industry was also a biomaterial. And basically, that's how a synthetic and a xenograft came into the dental marketplace. Quite fascinating. But the 3 that I mentioned were being produced for orthopedics. Fortos, what was it called? Resorb was a TCP, beta tricalcium phosphate. Fortos Perma was a hydroxyapatite, so more permanent. And then Fortos Sema was a gypsum, basically a purified calcium sulfate. And a couple of clinicians who now I know very well had the good idea to mix the 2. And that's really what became Fortos Vital, which was the first cement really into dentistry. But we just could not get through to what was a marketplace dominated by a xenograph then. And as a couple of my good friends say, we did too good a job at Guy Slick at the time, and we couldn't then market a synthetic. And the basic there were many differences, and we haven't got time to discuss it, but people were used to using a non-resorbable xenograft and had been trained and gone on courses and been involved in ways of using those that suited its parameters. And you came along with, first of all, a cement that you had to mix beforehand, that you had a few minutes to control, that went hard in the syringe, on the spatula, on the floor, goodness, everywhere. And then you got to get it in a different way. Then did you use a membrane? Didn't you? How did you use it? Then it resorbed. People would go back at 6 months and say, there's nothing here. It's all washed away. And it was easy to say, this is not going to work. And that was basically what Biocomposites did. After a couple of years, they threw the towel in and said, look, we've had it with dentistry. It's not going to work. And I had the fortune to say to them, well, okay, if you don't want to do it, I will. And that's where a product that you now know, Ethos, was developed. And Ethos was essentially a predicate of Fortos Vital. And we developed that and essentially took a totally different approach to the marketing and tried to come up with ways that were more appropriate for a product like that than trying to make the product fit existing protocols. And so I focused really my career then. I spent as a consultant with a couple of other companies, really developing the protocols for minimal access use of resorbable and in situ stabilizing bone graft. So
what made Ethos different then from the other products?
Which ones?
Well, the Fortos that you were talking about.
Nothing. It's exactly the same. Nothing to do with the product. It's all to do with the protocol and making use of it. If we go back to when Fortos Vital was, provided to a dentist, that dentist was familiar with doing 2-stage surgery, probably a big flap, probably cutting the periosteum, would be coming from perio maybe and use membranes, routinely. So I had to make a big flap to get the access for a big membrane. And so you came along and challenged them by saying, well, you don't need half of those things. Pop this in, do this, do the other. It's easier. And of course, you know what it's like.
Okay, well, take me through the do this, because I mean, I'm talking sort of not necessarily Ethos, but let's say generic products that might be made up of the same stuff. Now, what I've often found is that I mix it up, put it on site, and I'm waiting for it to turn into concrete. And sometimes it doesn't turn into concrete. So what am I doing wrong?
Nothing, probably. It's just the random science or random pharmacology. But it can be controlled better, and that's a couple of things that we did. And you're quite right, and it's right to look at this generically, because while Ethos was going through the regulatory process, clearly we weren't selling. It's a pre-revenue company. I set up the consultancy and went to work for 2 or 3 other firms part-time. So exactly what you said there, Will, I developed and expanded this protocol across 4 or 5 similar technologies. I promote 2 of those now. We have a relationship with the manufacturers, but I worked to help the protocol for EasyGraft, which is basically the same. So Fortos Vital, Ethos, EasyGraft, Powerbone Putty, which I'm involved with now, product called Gelos, which I'm involved with now, and 1 or 2 others, are all a similar ilk, effectively. And to make them more successful, what we had to do was help the clinician make use of those advantages. So, for instance, I went away and developed the degranulation burrs that most people know about now. And we realized that when people were using a non-resorbable graft, they could get away with some soft tissue in there, but you don't want it, but it didn't make a big difference. But if that's then competing with a resorbable graft, then of course the degranulation tissue generally wins. So it was important to perhaps prepare the site better to get a good bleed, because the porosity of the synthetic materials is slightly different. So these new tools, if you like, or modifying existing burrs to be used in different ways, enabled people to create a better environment for healing. And I think
from my point of view, Rob, it seems as though Ethos seems to have got a foothold through social media, perhaps. I
think that's exactly what I didn't say earlier. One of the key things, timing is crucial, isn't it, in any business, in any environment. And if I think back to Fortos Vital days, there I was sitting in an office thinking, okay, I've got the globe available. I'm an international director. I've got to recruit distributors. How are we going to reach the clinicians? How do we go to market? And critically, at that point, it's only 10, 12 years ago, a rep still had to knock on a door and talk to you guys. Or you met him at a congress or a hands-on. We hadn't even got, I don't know when Facebook was launched, but none of us were really using it around that time. Not long afterwards, we probably started to use it. And these channels have enabled small companies and newer technologies to grow at a much more rapid rate, because people can present good clinical work to a group of people at a low cost and quickly. And I think that's been certainly it's what's enabled me to set up effectively an online type business now. And it's certainly what's propagated the success of Ethos when Vital is essentially the same thing and couldn't do it. So I think there's three things. It's an interesting discussion. I think there's the communication channels have changed and the virtual world has come in. I think attitudes towards implantology are different. Patients demand shorter treatments, don't they? You guys want to do something that's less invasive on the soft tissue for obvious aesthetic reasons. And so that favours a minimal intervention approach, and it favours a resorbable bone graft generally, because you will create more bone. But you maybe have to accept some lower predictability, as you said, Will. Maybe that's the disadvantage, if you like, of a resorbable, is it might resorb a bit quick, it might go hard, whatever. And so these are the challenges I think that we're working on now with various different products to try and make that more predictable and learn even more about how we can utilize them.
Time's going on, gentlemen. Have you got many more questions that we can explore?
Yeah, I mean the predictability, I think that's one of the key things, isn't it? And
yeah,
I mean that probably is one of the more sort of, if I like, barriers, I think, is the unpredictability side of things.
Yeah.
So I mean I'm not asking you to commit or anything like that, but would you say there are certain situations where this product actually works very, very well and is more predictable, and there are certain situations where actually we get is there a sort of a limit to where we start to see a less predictable outcome? And where I might lead you with that is, if we've got a small defect, would we get something comparable to a xenograft? And when we've got a larger defect, might we be better using something that's got a very low substitution value compared to...
I think this is thank you. This is exactly what I've done with the Regen store. I've, over 3 years with all my manufacturing contacts, tried to build up, and we're about to go live with a full portfolio of products matched to indications. So I've developed the consultancy. What I realized with people were, phoning me or asking me or suggesting somebody made a contact and saying, well, I've got this particular case, what do you recommend? And in the discussion, you realize that, quite clearly through their experience and their beliefs, you might recommend something different in one situation to the other. And so one size does not fit all. Okay, one size might fit 75%, but as you rightfully say, it doesn't fit everything. So that's exactly the portfolio and the idea. And the Regen store will do exactly that. And I'm just about to add allograft, which is the other thing that I think is on the growth spurt now for various reasons. And I think as people get used to using, perhaps I've noted people using centrifuged blood now. So they're thinking more about adding cells into there and making more of a bioactive mixture. Then I think the role of allograft and demineralized bone putties increases again. So whilst they perhaps were not major players 15, 20 years ago, I think the role for them has increased in the last few years at the expense of xenograft, I would say, probably.
Yeah. And I mean, there's all sorts of things, isn't there? There's the ethical side of things.
Oh, lots of discussion and positive and negatives to all of them, indeed. And the licensing from our side is different for each one. Allografts, it's another discussion. Allografts are not medical devices, so the regulations to bring them to market is totally different. The documentation you guys have to keep is different.
And you mentioned the product there that you're with at the moment. So I'm assuming you're not sort of involved with Ethos.
No, I'm not. That's right. Unfortunately, you can't get on with everybody all the time, can you? And although I'm close to Peter, I'm not.
And Powerbone, you mentioned as.
Yes. So that's this back. It's a very interesting story, and it's maybe for another time. But back in my orthopedic days, when we were launching Footos Vital and transitioning into dentistry with some orthopedic products, St Mary's University had a development of a more advanced version of beta-tricalcium phosphate, thing called silicate substituted. So it's a bit like a glass and a TCP combined. And they did phenomenally well in orthopedics, so 10 years history now. And when I developed Ethos, I couldn't find anybody that would make this for us. But Powerbone is an orthopedic firm that will make it. So I work as a consultant for them, and in return, they supply us product and favourable rates and help me with setting up the business. And they have a range now of synthetics based on silicate substituted TCP, which is the most active synthetic there is today. And that's produced in various formats. So what you said then actually is exactly right. We've modified the format to suit the surgical conditions. So there's a putty, there's a gel, there's a paste, there's a particle, there's a block, there's a sponge, and each one has a different handling characteristic. Will take a screw or won't take a screw, can be applied directly onto the surface or used in sort of ridge augmentation. And it's a fascinating space, and that's underpinning our business at the moment. And their support is excellent.
I think for me, that sort of thing is finding a sort of a non-autogenous block that will be as predictable as an autogenous block. Is probably the holy grail, because I haven't done a block graft maybe in for at least a year. And I was doing fewer and fewer. Obviously, patients can't stand it either. It's not much fun for them. So finding that predictability in that, I think, will certainly revolutionise implant dentistry in many ways.
Indeed, there's a polymer material they produce, which is a little bit, as a layman, is like a spider creating a web. They create a really thin polymer, like a fine fibre, and then they intertwine it to make a sponge and impregnate that with particulate bone. And that particulate bone has a porosity, and the fibre has a porosity itself. So both will take up blood and fluids and cells in different ways. And there's enough flexibility in the thickness, is 4 millimetre or so, to take a screw. Now, it's designed primarily for surgical cages for spinal fusion, but we've got the opportunity to develop that for onlay grafting in exactly the way you say there, Will, perhaps with PRF. I've been knocking on Shukroon's door to try and get him to sort of collaborate, but he's French, he's a long way away, and doesn't always want to answer the phone calls of a black country lad who doesn't. But he does know me from the past. I have worked with him, but I'm talking to a couple of other clinicians, maxillofacial oral surgeons, to document some cases and just learn the best handling techniques. But I do think you're right. I think that we are on the cusp of maybe an opportunity there. I'm not the proverbial salesman who will say anymore. Until I see some cases that I think are comfortable, I wouldn't make any big claims. But I do think that what we've got should be right.
Well, yeah, that's interesting. And I guess for another day we could all talk about vertical augmentation and another layer of predictability or unpredictability.
Well, quite. Exactly what you said. Anthony Benkowski was somebody I was close to, from still am, but close to for many years as in training days. And we used to teach block grafting routinely, as I said, on cadaver courses and others. But I don't think many people do it now, do they? I think we've realised they all resorb, or most of them disappear at some rate, and the long-term success is not what we first thought. So there's clearly a need to fill that space with something.
Yeah, no, that's really interesting. Thanks, Rob.
Yeah, no, it's a pleasure. So that's Kate. That's really the basis of the business. Is yes, we've got to sell something. A box has to change hands to make money. But what I want to try and be able to do is differentiate ourselves with the advice and the knowledge to be able to say, okay, what is it you're actually looking to do? We know it's GBR, but in what way? How old's the patient? What's your preferred technique? Okay, this would probably be better than that. And so it's took me nearly 3 years to build up that full portfolio. And then we're incorporating it into a workflow that involves pre-implant consent and sadly at the end, review surgery, post-implant, peri-implantitis, antibiotics, etc. I'm quite happy with the way it's been going, actually. We have to sell a few implant screws as well, but that's the boring bit.
It's exciting times for you, though, Rob. I mean, you must be very, very excited and very proud at the same time. I mean, do you have time to actually take stock of how far you've come?
No.
I think that's the same with a lot of people.
You should.
To be fair.
Yeah,
yes, exactly.
I think you're right. Actually, a fat cigar or sitting outside of the drink and just mulling things over. I mean, we've all got histories. No matter who or what we do, we've got a background that's took us at some point to a crossroads or many crossroads, and you end up somewhere sometimes that isn't where you planned to go, don't you? And in a way, that's quite nice, isn't it?
Or you can still learn something from being there, can't you? Even if it's not where you want to be.
Very much so. And as I've said,
Will signed up for environmental studies.
With his scooters.
Exactly.
It's the only way. There seems to be lots of teeth in this.
It's the only way I travel.
Yeah.
You'll create more full arch cases if you keep driving into people.
Absolutely.
Probably my own as well.
Well, gentlemen, I'll tell you what. I mean, we know that these sessions go really, really quick, but I'm afraid we've reached that magical time of our Friday evening. I want to say a massive thank you, Rob. Thank you very, very much for sharing that with you. And we really do wish you all the success with this business. I'm sure you're going to take it to great heights.
We'll be delighted to help with hands-on or any training that you guys might want to do. I think that's the way forward to get people more involved with your clinical skills and my product sort of knowledge. I think there's an opportunity there, and our West Midlands background won't do us any harm either, will it? So.
It won't. Well, thank you, Robert. Gentlemen, as always, Mr. Murphy, Mr. Horton, thank you very, very much. Don't forget tomorrow night,
England.
I hope a cricket game and Worcestershire cricketing board have let us start early. So we can finish early.
There's rugby as well.
Yes,
Lions game.
I'm not moving.
There might even be some tennis on as well.
Bit of tennis.
Oh my goodness! Oh my goodness!
Stay on the sofa, everyone.
Absolutely. Well, everybody out there, whatever you do this weekend, we hope you have a fantastic one, and we look forward to seeing you this time next week. Ciao, everybody.
Thank you. Bye. Bye.
Bye.